Well, love the skin you're in and treat it right, but when your skin betrays you, it is time to call an expert.
We're joined by dermatologist Dr. Mercy with more. How are you?
Good morning, Dr. Mercy.
Good morning. How are you guys doing?
Fantastic. Okay, so I have to tell you, your skin is radiant, which of course we expect it to be as a dermatologist, but it just cracks me up the way that you are so comfortable with some of the most uncomfortable things that happen to people.
Yeah, it's uncomfortable for us.
I love what I do, and most patients already come in feeling uncomfortable, so I have to do my best to make them feel relaxed.
Yes, definitely, definitely.
Okay, so what is your show is coming up on TLC. What should we prepare for when we get ready to watch your show? Because it's not something that you want to be eating cornflakes while you
have some extreme cases that you're sharing.
Yes, yes. So you don't want to eat dinner when you're watching the show. But there's lots of heart to it. There's lots of surgery, lots of lipomas, lots of cysts, lots of things oozing out. But there's also her story. There's a journey with these patients, and it's heartfelt. So you can eat dinner, but for most people, probably not.
Dr. Odueyungbo, how did you get into the extreme cases in dermatology that you see? You seem to specialize.
It's weird. I think they just kind of, they find me. You know, when I first started my career, I always joked that all my colleagues were doing all these beautiful things like Botox, filler. And for some weird reason, the only thing that I would get was like this big cyst and lipoma. And I guess I just became known for it.
Okay. We're seeing
that's all I ever got.
Hugging your patients there. And, you know, I know that it's very hard, I can imagine, for them to, you know, be in public with their conditions, but you hug them and make them feel it's okay.
And that's one of the biggest messages about doing a show. A lot of times people think that they're contagious. People think that they would get it just by touching them. And most of these patients, their conditions is not contagious. And if just by watching me touch it, move it, hug them, just to show that they're just normal people like we are.
Okay.
This is awesome. Well, you are definitely the person with the heart, and you should be on TLC because it's the perfect station for you.
I got a quick question. Oh, go ahead, Gordon.
No, go ahead.
I was going to say, do you like the new Shawn Mendes song?
What?
Do you know it?
What song is that?
Here we go. It's called Mercy.
It's a good one.
There you go.
Dr. Mercy Odueyungbo,
it is a good one.
Your new show coming up on TLC this Wednesday. Thank you so much for your time this morning, and continue to be the heart-caring person that you are.
Oh, thank you guys for having me. I appreciate it.
Absolutely. She's so sweet. She does have her own theme song, huh?
Check it out, because I know a lot of people like to watch shows like that.
Oh, yeah, for sure.
You know, it's like you're curious, but then you're like, oh, wait, a little bit more.
You watch like this.
You watch like that, yeah.